So arrived in Port Vila, I was handed a set of keys and we've secured you a building for the station and here's a checkbook and a bank account. There's no money in it. Now go run an ambulance service. The hospital there, Northern Provincial Hospital, did have a vehicle. It was a troop carrier with a stretcher in the back, and that was it. There was no equipment. There were no trained personnel. They would have found someone in the hospital who could drive within business hours, and that was the level of out-of-hospital care available on an island of a population of 30,000 people. I'd spent some time in Vanuatu volunteering for a medical clinic, and my wife's a school teacher and she was working in a local school. And through that experience, we bumped into the National Operations Manager for Paramedical, which was a non-government charity ambulance service in Port Vila, which is the capital, and got to chatting and Mick was his name, and he's like, oh, I'm an ex-Ambulance Victoria paramedic. Next time you come over, why don't you work for me? So for a couple of years, I volunteered my annual leave block. There was the chance to go over full-time and start a new station and a new service. So I actually spent 2013 in Australia fundraising, for want of a better term. I contacted every ambulance service in Australia, writing letters to their commissioners or CEOs asking for support. I was at one of the Australian Paramedic College conferences. I actually ran into the owners of Neon, which is the company that creates all of the equipment bags for the services around Australia. They said, oh, next time you're driving past our factory, which is in Geelong, just outside of Melbourne, they said, drop in and say hello. So dropped in to see them and they said, open the boot. And I opened the boot of my car and they loaded my car up with equipment bags, oxygen kits, drug kits, oxygen cylinders, oxygen regulators, spine boards, neck collars, all of these pieces of equipment that services had, like the first iterations of gear bags that services, were trialing that didn't get up. And so they just filled my car up with donations. Wow. And that was the start of the service. And then the big one was Queensland Ambulance Service. So the commissioner reached out and said, we'd like to donate a vehicle. And this was huge because I had no pre-existing relationship with QAS, but they donated a Land Cruiser troop carrier ambulance. And that was it. We were off and running. I'm not sure what we would have done if someone hadn't got on board with a vehicle. It was after that it just started to feel real. And then obviously Ambulance Victoria and the local stations around the region I worked then started donating some bits and pieces as well. So it was that small trickle to start with and some, individuals and companies in Australia that liked what was happening and they got on board and that was how ProMed Santo started in an Australian, paramedicine system where if you needed something, you walked into the officer in charge's office and appeared to be an endless bucket of money. I got paid every fortnight. I didn't have to worry about where that was coming from. Moving to Santo and getting off the boat in Santo and unloading the ambulance, there was no money. There was nothing. And so it was, how do I keep this operation running? So first of all, I needed staff. I couldn't run ambulance operations by myself. So we did a call and we put an ad out and we were looking for nurses or people who had medical experience to transition to this new idea of out-of-hospital care in Santo. We selected 2 nurses to be our trainee paramedics, Avong and Jerome. And the next step was then securing finance. And as basic as that sounds, it was walking down the main street of Luganville and knocking on every door of every business and introducing myself and saying, hi, Andrew, this is ProMedical Santo. We would love your help. And so it was about donations or providing sponsorship. And so we developed a sponsorship package. So the ambulance essentially became a billboard. And I know that might sound funny from people coming from a high income country ambulance service, but we needed to thank those businesses that came on board. So if you donated a certain amount of money, you got a big sticker on the side of our ambulance. So if you donated, you would get free cover for you and your staff for this period of time. So the first couple of weeks was lots of door knocking, lots of hitting the pavement and getting support. We were lucky. There was obviously parts of the community that really wanted us there, and they got behind us from the beginning. But the biggest, win in that first month was a local petrol station donated free fuel. So our fuel bill was covered. They were a Pacific Petroleum. They were our first big sponsor. Anytime you want, just come around, fill up. This is how we're going to support you. And it just sort of snowballed from there.
From those early days, you must have gained a bit of confidence that this is going to actually turn out for the better.
Oh, yeah, for sure. Yeah. And once you started getting people coming on board, it felt great. We positioned ourselves as a professional ambulance service. We wore a uniform, and everyone knew the ProMed truck when it drove down the main street. So it was that visible presence as well that was really important. It's a big challenge for us in teaching the community what, out of hospital care is. We had stickers, ProMedical, Santo, our contact number was 115. And so 115 keeps you alive, something catchy. Put it on a sticker. Here you go. Here's a sticker. The other big one for us was getting into the schools. So part of the subscription service that we introduced, we also had a school subscription. So for a certain amount of, money each year, the schools would get cover for their students and their staff. But we would then go visit the schools and talk to the kids about some basic first aid, but also this is an ambulance and this is why you call an ambulance and this is how you call an ambulance. So, getting to the kids, we would volunteer to have an ambulance on standby at sporting events. So there's amateur boxing in Santo, there's soccer, they've got their annual rodeo. So we would volunteer, park the ambulance, and so we were visible. So it was about that visible presence, and then people could come up, have a chat. I remember one of the funny parts of that, we did a radio segment and we spoke about ProMedical Vanuatu, and this is the number you call, and 24 hours a day we'll answer the phone. I remember one night, it was like 11 p.m. So Vanuatu doesn't have a centralized call center. If someone rings 115, it goes to the mobile phone in my pocket or one of the other paramedics. So we get the call directly. And so it was like 11:30 at night, and the phone rings and I pick it up. So, ProMedical, Andrew speaking. What's your emergency? Oh, no emergency. Oh, okay. Oh, I heard your radio interview today and it said you'd answer the phone 24 hours a day. So I just wanted to see if that was true. And I'm like, it is true. It is true. Yes, I will answer the phone whenever, but the phone is for medical emergencies. Okay. I just wanted to check if that was real and hung up. And it was like, well, I guess they listened to the interview, but they just wanted to make sure that, okay, this guy is going to pick up the phone 24 hours a day. One of the things about Vanuatu and potentially other low and middle income areas is the smaller health centres located in us. So Santo's an island. So yes, there was a Northern Provincial Hospital in Luganville, but there were lots of small health centres and dispensaries dotted around the island. And we were the transport link from those health centres back to the Northern Provincial Hospital. And I remember one case, and we were called to help one of these outlying centres to a patient that they'd been there for a couple of days and they were deteriorating rapidly, and we met them en route. And this is the thing. So they'd started transporting this patient in a dual cab ute, in the tray of the ute. And we arrived and met them on the side of the road, and the patient is sitting up in a plastic chair in the back of the ute with a nurse holding a mask on their face. And, so we obviously took over care, but, the patient was critically unwell with sepsis, and they'd just been sitting on this patient at the clinic for 3 or 4 days, not knowing what to do. So, there was this increasing complexity in the cases that we were being called to respond to because we were that link, and we positioned ourselves as a professional ambulance service, and we were running to international or Australian levels of care. So people were beginning to understand that the service we could offer. And so complex cardiac cases, sepsis was a big one, and sepsis and seeing the types of injuries and illnesses in those outlying communities that people were dying from was what prompted the next step in the development of our operations in Santo. And I thought it was a logical step at the time was a community first responder program. So I think that there were two cases in particular. Number one, it was this sepsis case. The second one was, it was actually two. It was the same day. We were called to a small child that had been hit by a car crossing the road, and we arrived on scene, and the local police were there, and they said, "Oh, we threw them in the back of the truck and we drove them to hospital." And I'm like, okay. So we followed up at hospital, and the child had a compound fractured femur, and so it's obviously a significant injury anywhere in the world, but in a low resource setting like Vanuatu is a very, very significant injury. While we were there, another car pulled up out the front of the ambulance, at the front of the hospital, and they brought this patient in who was using a angle grinder, and the blade of the angle grinder shattered and had hit the patient in the thigh and had severed their femoral artery, and they had an arterial bleed, and they put on a makeshift tourniquet. And there's just sparked something in me and said, we're here. Maybe we need to be looking at empowering the community to do some basic first aid as well. So, and that's sort of where we call it the VFAR, the Village First Aid Responder Program, was sort of born from.